Joining me now to discuss the large topic of travel health is Christopher Sanford, MD. Dr. Sanford is an associate professor of family medicine and global health at the University of Washington. He is also an expert in tropical medicine and traveler's health and the co-editor of a very fantastic book, and I encourage you to check it out. It is called the Travel and Tropical Disease Manual. Dr. Sanford, welcome to the show, sir.
Hey, thanks much for having me.
You bet. This is a huge topic, so many things that can be talked about, so I had to really chop it down to just a handful of things. And let's go ahead and start with an intro of, what is travel health, travel medicine, and why is it important?
Sure. Basically, when folks go particularly to low-income countries, they're exposed to infectious illnesses and other threats that really are not threats back at home in the high-income countries. And so if someone's going to most of Asia or Africa or Latin America, it's reasonable to see a doc who has some expertise in travel medicine to talk about everything from additional immunizations to malaria prevention by taking a pill, traveler's diarrhea, car crash, risk reduction, and things like that.
Now, obviously, I believe, if someone was planning overseas travel, you, as a travel medicine doctor, would suggest them consulting a travel medicine physician or going to a travel health clinic. If I was to go to a travel health clinic, what would I expect?
Good thing. Well, basically, first off, I would go to a place that does some travel health on a regular basis. And not every doctor does that. Some family practice doctors do and most don't, and some internists do and most don't. So first I would go online and see if your clinic does that kind of thing, because not all of them, for example, carry the vaccines like typhoid fever and yellow fever, the more the travel clinics tend to have. What you would then do is have an encounter, ideally one-on-one, and you would be subjected to a lot of nosy questions. So the doc would ask you about your itinerary, your planned activities, and then your past medical history. Are you pregnant, or are you immunosuppressed in some way? And then what is your past vaccine record? Because that will, of course, inform the recommendations for vaccines. You should be told where there is and is not malaria, where you're going to, if you need to take a malaria pill or not. If you do, what are the side effects of the various options? What are the costs? Another topic that pretty much is always talked about is traveler's diarrhea, which is the most common infectious illness. It's minor, but it's bothersome and it's common. And often doctors will offer to write for an antibiotic that you take only if you get diarrhea. It makes it go away a little quicker. And then there's a whole potpourri of topics that we cover. As I say, the biggest threat actually to young travelers is car crashes. So we talk about everything, mundane topics like seat belts and not getting on the roof of the bus like the local people do. And then everything from travel evacuation insurance to sunburn to, various other threats that can come up depending on the itinerary. And then if you have particular activities, like if you're scuba diving or high mountain climbing or something like that, that will open up a whole new host of potential topics.
Sure. Well, just in that little presentation you gave, we'll be discussing several of those issues right now. And the first one I want to talk about is vaccines, a huge part of travel health. Now, the routine vaccines like the MMR and the diphtheria, tetanus, pertussis are important in just keeping healthy in everyday life, but it's also quite a concern when it comes to traveling.
If anything, correct. It's a bigger concern when you travel because most of those illnesses like pertussis are more common in low-income countries. Measles, mumps, rubella, all of them more common in low-income countries.
Yeah, so essentially anybody that came by your office for travel advice, you would ensure routine immunizations were up to snuff.
I would recommend it. And that actually people often come in wanting to talk about the fancy stuff, so about yellow fever, Japanese encephalitis, and the vaccines they associate with travel. But before I talk about that, I insist on talking about things as mundane as, like you said, measles, mumps, rubella, and influenza, and hepatitis A, and other things that are on the routine U.S. schedule. Yeah. And only after I've covered that, which actually is more important, those are the more common illnesses in travelers if they don't get vaccinated, only after that will I talk so-called travel vaccines.
Sure. And for example, things like measles, when we do see a measles case here in the United States, I mean, the vast majority of the time, it is due to overseas travel.
Exactly. Or someone who lived overseas who moved here, or someone, you're exactly right, who didn't have immunity, who traveled and then came back.
Sure. Okay, well, one of the biggest stories on the website, outbreaknewstoday.com in the past month or so has been the yellow fever outbreak in Brazil. Can you give an overview of the required, recommended vaccines, and specifically talk about the yellow fever vaccine in some detail, if you can?
You bet. First off, there's the distinction between required and recommended. Everything we just talked about is recommended, sometimes rather emphatically, such as influenza, but it's not mandatory. The list of mandatory things is very short indeed. That would include yellow fever in many countries in Africa and possibly in South America, although in theory almost no place in South America requires it. However, there's not always a good correlation between what technically is required and what actually is required, such that last time I went to Tanzania, which by sort of international law does not require yellow fever, the guy at the airport asked me for yellow fever proof of vaccination. And so basically, if anyone is going to an area which is yellow fever endemic, which is most of tropical Africa and most of tropical South America, I'll recommend the yellow fever vaccine. And indeed, if they're going to Africa, they may be required to show proof of having it before they can get through customs. And on that short list of required vaccines, the only one that comes up sometimes other than yellow fever is meningococcal meningitis, which comes up for Muslims who are going to the Hajj. So if you're doing the pilgrimage to the Hajj in Saudi Arabia, the Saudi Arabian government requires proof of meningococcal meningitis immunization before they let you into the country. But with the exception of those two, in most cases, yellow fever and meningococcal meningitis, everything else is recommended, but not mandatory.
And how does a traveler show proof when they arrive at the country?
There is a yellow vaccine card, a several-page little pamphlet, and we give it out for free. It's put together by the WHO. And on that, for yellow fever, I fill out the yellow fever form, and I stamp it with my special yellow fever stamp, and I sign it. And that indicates that I, as a yellow fever vaccine provider, have authenticated that the person is current for yellow fever vaccine.
Yeah, and there's only select physicians or clinics that can give the yellow fever also, right?
Correct, because if the doc isn't seeing a lot of travel people, it doesn't really make sense to stock yellow fever vaccine.
Sure.
So I have it, and pretty much all travel clinics have it. But again, somebody would want to call their doc ahead of time and say, hey, if they don't have it, who in the neighborhood does do it? There's usually somebody in every good-sized community who will do travel medicine.
Right. Now, another concern when traveling is the different mosquito-borne diseases and other vectors. So what advice do you give for preventing mosquito and insect bites when you're traveling? You bet.
Well, the first thing I talk about with malaria is not an anti-malarial, although I get there eventually. The first thing I talk about is general mosquito avoidance advice, because for the malaria prevention pill like Malarone or methylquine or doxycycline, you only get protection for one illness. But if you talk about what we call PPMs, personal protection measures, then you get protection for essentially all mosquito-borne illnesses, and this would include malaria, dengue fever, Zika, chikungunya. And in the U.S., there's vaccines for none of those. There's only a preventative pill for malaria. And so for the very common dengue fever and the somewhat less common Zika and chikungunya, all spread by mosquitoes, really your protection is a repellent to skin, and that could be DEET or picaridin, probably the best two. Only goes to exposed skin. Second thing we recommend is putting something to the clothing, something called permethrin. It has no smell or no color, and you can either get clothing pre-impregnated with permethrin or you can buy a spray can yourself fairly cheap. The third key is sleeping under a bed net, and that works better if it's treated with permethrin. And then there's some other things that also give benefit, like wearing long sleeves and long pants. So after I've talked about all that, that gives you most of the insect protection. Then specifically for malaria, I'll talk about a malaria preventative medication.
Yeah, and that segues right into my next question. Malaria is it is a mosquito-borne, well, it's a parasite, but it's incredibly dangerous, certain strains of it. And depending on where you travel, malaria prophylaxis may be warranted. And can you explain to my audience, as a travel health physician, the differing criteria for malaria prophylaxis?
You bet. Malaria is present in about 100 countries around the world, essentially all around the equator. It's in all the hot, tropical, humid places. It's not where there's desert because you need water for the mosquito since it's mosquito-borne. And in the olden days, chloroquine, a drug developed in the 1940s, worked very well everywhere. But there's been resistance to that in most of the countries in the world. So out of those roughly 100 countries, only about 10 does chloroquine still work, and that would include most of Central America and Hispaniola, which is Dominican Republic and Haiti. But in the great majority of countries in South America and Asia and Africa, we need to use one of the three for chloroquine-resistant malaria, and those three that we recommend in the U.S. is either mefloquine or Malarone or doxycycline, and those all have pros and cons. So first you look at a map and you see if malaria is there, then you ask about the activities, and then it gets a little technical. It's why it's good to see a specialist, because in some areas there's very little malaria. So if you're only there for a few hours, maybe it's not worth it. Versus, as you mentioned, some of the strains are life-threatening, particularly one called falciparum, which is the predominant strain in Africa, is life-threatening, and malaria is intensely transmitted in sub-Saharan Africa. So anyone going there, I strongly encourage to take an anti-malarial. In a place like Guatemala, there's a lot less malaria, and it's not falciparum, and so I still encourage an anti-malarial, but it's less important. So those are a few of the things that I go through with people.
Now, I don't know if you come across this kind of situation, but maybe a traveler that was going to select areas of Thailand and Laos and Cambodia where they have very, very drug-resistant malaria. Have you encountered a traveler yet?
I have, and luckily the preventative medications are still working well. Where we're seeing a resistance with places like Thailand and even sub-Saharan Africa is in the treatment. The primary category of drugs that's been used for treatments are called the artemisinin drugs. And unfortunately, we're seeing treatment failures with that drug. But for prevention, for one of the three that I mentioned, for Malarone and doxycycline and mefloquine, there's very, very, very little resistance. So little it essentially doesn't need to figure into your equation. Those three are still very efficacious preventative medications around the world.
Oh, very good. Okay, good. A topic you discussed earlier in the show was traveler's diarrhea.
Right.
A hugely common topic. And what are the risks, and what's the typical presentation of traveler's diarrhea?
You bet. I'm at a high school right now. I'm going to walk down the corridor and see if I can find a little quieter place.
Oh, sure.
If you're getting background noise.
A little bit, yeah.
Yes, I'm going to walk and see if I can find a quieter place. Well, that's the scourge of the traveler, and I kind of smile about it because it's not life-threatening, but it's really common, and almost anyone who's been to a low-income country will have had that. Your odds, even if you follow all the rules of getting an episode, if you spend 2 weeks in a low-income country, India, Kenya, where have you, is as high as 1 in 3 or a little higher. And so your control is pretty finite. So the risk is high. It's self-limited, but a key thing to know about it is usually if you get it in a low-income country, the cause is bacterial, so it'll often go away quicker with an antibiotic.
Now, so the traveler's diarrhea is kind of a generic term, but like you said, majority of the time it's bacterial, but it could be viral, it could be parasitic too.
It's different in the U.S. than in low-income countries. So yes, in the U.S., it's almost always food poisoning or viral, but in a low-income country, about 85% of the time, it's going to be bacterial.
Now, you talked about taking prophylactic antibiotics. Now, as a travel health specialist, do you recommend this, and how effective is it?
No, I don't, and it's kind of unknown. What I recommend is treatment if it occurs, what we call self-treatment. So prophylactic is taken in advance when you're still feeling good. And it might work, but antibiotics have side effects in and of themselves. They can cause diarrhea or a rash or cause resistance. So except for very select, maybe an immunocompromised traveler, I don't recommend prophylaxis, but I have the option of writing for an antibiotic prescription, which they take if they get diarrhea. But that's not mandatory because it goes away usually in a few days. If you do nothing, it just goes away quicker with the antibiotic. So it certainly is not a thing you must do.
Do you recommend to travelers about the use of Imodium?
I do, and my basic algorithm is if somebody feels good, they take nothing. If they get mild symptoms like loose stool, they take Imodium AD, which is loperamide over the counter. If they get bad diarrhea, like watery diarrhea, they use both the loperamide and the Imodium AD. And the last step is if they're sicker than usual, if they have blood in their stool or fever, then they see a doc. They don't take the Imodium.
Yeah. Okay, let's switch gears to the topic of rabies. Are there destinations or different activities where you would give pre-exposure rabies vaccination?
Yeah, good question, but not that many. I probably recommend Rabies Advance pre-exposure series for about 1% of my travelers. So now if you're going to a beach in Mexico for a couple of weeks, no. But if you're, say, a wildlife biologist, or if you're a spelunker, or you're collecting bats, or you're a backpacker out in the middle of nowhere for 6 months, I would recommend it. Reasons to get it is rabies is a lethal illness. Reasons not to get it is in the U.S. it's an expensive series costing about $1,000 to $1,200 for the 3 shots, and it's a really rare illness in travelers. But complicating it, dog bites are common, so it's sort of a one-on-one decision. But outside of people who are long duration or sort of exposed by their activities, it's not a routine recommendation for everybody.
So somebody that was going to do ecotourism.
It depends what that consisted of. If it consists of sitting in a car and driving, no. If it consists of collecting bats off nets, then yes.
Okay, and you talked about bats. So as a travel health physician, is there a concern for histoplasmosis when you're talking about spelunking?
Yeah, you bet. Fungal illness, you can get it from the dirt in a cave, and it's sort of a 1 in a million thing. But yeah, if folks come back with persistent pulmonary complaints, which is rare, but it's one of the things we think about.
Okay, I'm speaking to Dr. Christopher Sanford. He's a tropical medicine and traveler's health specialist from the University of Washington, and got about 2.5 minutes left in this segment. Dr. Sanford, something that pops up in the news every year, and that's cruise ship illnesses. Mm-hmm. Any special considerations concerning cruise ships?
In general, they're safe. I mean, you're on a big boat with a lot of life rafts, and it tends to be very safe. It is true, though, they have an increased incidence of a viral thing that I'm sure everybody's heard about called norovirus. So there are infrequently outbreaks of norovirus, which is very infectious and gives a lot of people severe diarrhea.
All right. Well, but in general, is this just because of the increase there, the handling of the food, or just the mass population of people in an enclosed environment?
You know, good question, and I'm not sure, but I think it's the crowding. It's just a lot of people from all over the world, both the food handlers and the travelers. And anytime you put 3,000 people in close proximity, anything infectious is going to spread quickly.
Okay. Now, let's switch gears out of the infectious agents and talk about some non-infectious disease issues that are concerned when you're traveling abroad. And if you could talk about some of the issues and prevention. And, for example, you talk about diving and altitude. Can you talk about some of those type of issues? You got about a minute.
You bet. First, the biggest threat to most travelers is cars. So statistically, what older people tend to die of if they die is heart attacks, and what younger people tend to die of if they die is car crashes. So I always talk about seat belts and avoiding motorcycles, and as I say, not getting on the roof of a bus. That's important for everybody. For diving, it's a good idea not to go in a jet for 24 hours after you fly. And for altitude illness, there's a medication called acetazolamide, which can be prescribed, which brings down the risk of acute mountain sickness. Well,
thank you, Dr. Christopher Sanford, for your time and expertise. I appreciate it very much.
Hey, you're very welcome. Good
Thank you. All right.
All best. Take care.
Excellent. Now,